I have a 6-year-old boy, and I love to be active, to play sports, and there's nothing worse than getting bumped in the glasses.
I could see everyone in the room like crystal clear, and it was immediate.
With LASIK surgery, no more contacts, you have perfect eyes, you can see down the cord, you can read everything you want to.
The best thing is that now I can dance with my husband cheek to cheek.
I love to play golf. I cannot believe how much my game has improved since the procedure.
We went out to the beach one day. I said, Carol, look, there's your kids, you know. And she goes, what? I says, well, you can see your kids. We're out in the water. We don't have our glasses off because you never could see them before. Now you can see them. Everything's clear and crisp. It was great.
The result was just what I wanted, 20/20 vision.
Hello, I'm Dr. Robert Weisenthal, Medical Director of LaserView of CNY. Thank you for taking the time to spend a few moments with us learning about the latest in laser technology for your eyes. At LaserView of CNY, we take great pride in being the largest and longest running laser center in Syracuse. During the 15 years we've been operating, at least 6 or 7 other laser centers in Syracuse and Canada have opened and then closed. The reason we are so successful is that we provide the highest quality care for our patients. Our patients enjoy going to the beach, playing sports, skiing, and traveling with reduced need for glasses and contact lenses. Our largest source of new patients is word of mouth, from one satisfied patient to another who refer their family members and friends to see us. Thousands of Central New Yorkers have trusted the doctors at LaserView with their most valuable sense, sight. It's important for you to know that before I performed a single laser procedure, I had the laser surgery myself because I thought that if it was good enough for you, then it was good enough for me. That goes for many of our surgeons and physicians in the community who've also had laser surgery so they can live a life free of glasses and contacts from many activities. In the 15 years since I've had the laser surgery, I've enjoyed seeing without the need for glasses. I feel very fortunate not to have to put in contacts first thing in the morning or search for my glasses under the table or next to the clock. I like the procedure so much, I helped bring the laser procedure to Central New York.
It certainly was a great convenience to do it right here in Syracuse. And also, you know, I had just heard such great things about the doctors, the way that they treated the patients, that, you know, I was compelled to want to do it here, and it really turned out to be exactly that way.
Hi, I'm Dr. Art Coley. At LaserView, we offer the newest in refractive laser technology to allow you to see clearly without glasses or contact lenses. Prior to surgery, your surgeon will see you for a complete eye exam to determine if you are a candidate for surgery and to custom design a procedure that will give you the very best result. Let's first talk about how your eye works normally. The human eye is an amazing structure and works just like a camera. Light rays that come into the eye are focused by the cornea and lens onto a very thin membrane in the back of the eye called the retina. The focused image on the retina is then transmitted to the brain by the optic nerve. If there is no refractive error, images on the retina are in precise focus and people do not require glasses or contact lenses. Refractive errors are caused by an abnormal shape of the cornea or abnormal eye length. The kinds of refractive errors people could have are myopia, hyperopia, and astigmatism. In myopia, or nearsightedness, light rays focus in front of the retina. Images at a distance are blurred, but images up close are clear. In hyperopia, or farsightedness, light rays are focused behind the retina, and images at near are blurred. Images at a distance may also be blurred depending upon the degree of hyperopia and the age of the patient. In astigmatism, light rays do not come to a single point of focus for clear vision. Instead, light focuses at 2 distinct points, neither of which is in focus on the retina. This results in distortion or blur at all distances, near and far. When we are young, the lens of the eye is very flexible and allows us to focus at near. As we become older, the lens becomes stiffer and loses its ability to focus at near. This process is called presbyopia. It usually starts in the mid to late 40s. In the early stages, people require more light for reading and are required to move reading material further away from their eyes. Presbyopia happens to everyone, even those who have never worn glasses or contact lenses before. After refractive surgery, patients over 40 may require reading glasses for near vision. Some people who have presbyopia choose to achieve monovision, where we correct one eye for distance and one eye for near, so glasses aren't necessary. Monovision can be done with contact lenses, but also can be achieved with refractive eye surgery.
I wore contacts for 7 years, but because of allergies, contacts became a distraction. So I decided to go to LaserView of CNY. From the first appointment, I knew I wanted the surgery.
Hi, my name is Dr. Steve Spitzer. Are you a candidate for laser vision correction? What is the preoperative examination? Laser surgery is an amazing technology that gives millions of people the opportunity to decrease their dependence on glasses every year. However, not everyone is an appropriate candidate, and a thorough exam by your surgeon, not a technician, is essential to an optimal result. The surgeons at LaserView conduct an extensive evaluation of your eyes and health to ensure your candidacy for laser surgery. This includes a refraction with and without dilation, corneal mapping to check for abnormal shapes of the surface of your eye, corneal thickness tests to confirm a sufficient amount of tissue to work with, tests for dry eye, inflammation, and cataracts are also performed. A microscope exam of your eyes, including the cornea, lens, retina, and optic nerve, are also included. These exam elements are invaluable to your surgeon's assessment of your eyes. Based on this information, an informed discussion about your laser vision candidacy can be conducted and an appropriate course of treatment determined.
I would recommend LaserView to anyone that wanted to have laser surgery. The staff was courteous, they were professional, they were so patient with me. I was extremely nervous, and I had someone to hold my hand the whole time.
Welcome to the operating room. Your visit here will be short and sweet, and most often you don't remember you were even here thanks to the medications that we give before the surgery to help relax you. In the background, you can see the laser. Even though we are the largest and oldest laser surgery center in central New York, doesn't mean we rest on our laurels. Our mission is to always provide the best in laser eye surgery, which requires that we continually search for and invest in the latest laser technology.
Well, one cool thing about laser eye surgery is that I got the rest of my teammates jealous because now they wanted to get perfect vision also.
Hi, I'm Dr. John Costello Jr. Since our opening in 1995, we have upgraded our laser 8 times. The latest purchase of equipment was just 3 months ago. We were the first facility in Central New York to bring you Lasik correction for nearsightedness, the first for laser correction for astigmatism, and the first for laser correction for farsightedness. Every laser patient gets the very thorough eye exam by their LaserView surgeon. Your surgeon gets to know you so he can better understand what your visual needs are. An orb scan is one of the advanced screening scans performed on every LaserView patient. The orb scan measures the anterior and posterior elevations of your eye's cornea. It also measures the thickness of your cornea, among many other measurements very useful to your surgeon to determine your candidacy. Another test that can be done, if your situation requires, is a Xi-Wave test. This test allows your surgeon to do a customized treatment. The cornea is like your fingerprint in that no one's cornea is the same. The test maps out the peaks and valleys in your cornea. This information is placed in the laser so the laser can perform an ablation customized for your individual eye. A customized treatment lowers high-order aberrations and smooths out the peaks and valleys in your cornea. Every patient at LaserView gets an iris recognition scan. With your scan, the laser can now recognize your eye as you lay on the surgical table in the operating room. This is an excellent safety tool for both patient and surgeon, but most importantly, this scan, in conjunction with our tracking system, allows the laser to follow your pupil in the event your eye moves. The ACE iris recognition system is our latest addition in our state-of-the-art technology. This system also becomes very helpful for those patients who have astigmatism. The eye sometimes rotates a few degrees when you go from sitting position to the horizontal position. These degrees can be very important if you have astigmatism, since treating exactly the position of your astigmatism axis is key to the success of the treatment. We are proud to use the 100 Hz Technolos Bausch & Lomb laser. This new generation excimer laser utilizes an innovative technology called flying spot laser technology. A narrow beam, about 2 millimeters wide, contacts the eye at a lightning speed in an alternating pattern that allows for a uniform corneal ablation. Energy delivery is more accurate due to this alternating delivery pattern. This leads to improved visual outcomes and avoidance of complications such as central islands. This technology produces a smoother corneal shape and helps increase the accuracy and efficiency of our surgery. Our laser can treat patients who need a conventional treatment as well as customized procedures depending on what your individual need as determined by your surgeon. If you are having LASIK, we have several state-of-the-art devices to utilize. We will choose the one that best fits your needs. We are proud to have the Amadeus keratome, the CB Moria keratome, and the all-laser LASIK technology for a bladeless procedure. We are proud of our track record in providing these breakthroughs for you, and you can be assured that we will be on the cutting edge using the best equipment and techniques for our patients.
The doctor and the staff were very courteous, very professional, and it was a very comfortable experience the whole way through.
Welcome to LaserView of Central New York. My name is Dr. Leslie Woodcock. No matter how ready you are for life without glasses or contacts, the decision to have LASIK is a big one. You want to know for certain that you're getting the safest, most trusted treatment available. That's why our doctors at LaserView offer an advanced approach to LASIK called the intralaser method. With the intralaser procedure, you can have a LASIK procedure that's 100% blade-free and shown in clinical studies to take more patients to 20/20 vision and beyond. What is the intralaser method? The intralaser method is a 100% blade-free approach to creating your corneal flap, the thin flap of tissue that the doctor folds back in order to perform your LASIK procedure. The intralaser method can only be performed using the intralaser FS laser. With the intralaser method, tiny pulses of laser light pass harmlessly through the outer portion of your cornea and form a uniform layer of microscopic bubbles just beneath the surface of your eye. The exact dimension of the flap is determined by your doctor based on what's best for your eye and is computer controlled for maximum precision. When it's time for your LASIK treatment to be performed, your doctor easily separates the tissue where these bubbles occur and then folds the flap back. When LASIK is complete, a flap created using the intralaser method is uniquely able to lock back into place. Your eye then begins to heal rapidly. What else should you know about LASIK? Well, for the purposes of our demonstration here today in education, I'd like to show you the basic procedure. The patient will lie down here on this bed. They'll put their head into a foam block to maintain their posture. We use this very simple suction device to dock onto their eye. We then rotate the patient to the intralaser machine, where we slowly lower the laser cone down into the suction ring. Once that is docked appropriately to your eye with the right amount of suction, we move over to our laser screen. We program the pre-desired flap position and start the 22-second procedure. After that is done, we simply take the suction ring off your eye, separate out the flap, and perform your LASIK procedure.
Actually, my wife, Carol here, she's the one that talked me into it. She went first, and she liked it so much that I had to follow along because I was so excited how pleased she was with it that I think I wanted to do the same thing. I'm very happy with it.
After your laser procedure, you are followed closely by your doctor in his office to ensure that you have the normal healing response to treatment. Common side effects associated with the procedure include glare and halos at night, fluctuating vision due to dryness, and sensitivity to light and to touch. Rare but important possible effects of surgery are infection, hemorrhage, and corneal scarring. It is in this post-operative period that the surgeons of LaserView provide the personal care that differentiates us from other laser centers. Close follow-up produces the best outcomes. Our doctors all practice full-time in this area, so they are only a phone call or a short trip away.